Hi, my name is Hassan Ghumrawi, and I'm the Vice Chair of Research and Innovation and Associate Professor in the Department of Orthopedic Surgery at the University of Alabama at Birmingham. I'm talking to you today about my JBJS article, The Cost Effectiveness of Computer Assisted Compared with Conventional Total Knee Arthroplasty, a Payer's Perspective. Two prior studies led us to conduct the current study. A trend analysis showing that there was a shy increase in utilization of computer-assisted knee arthroplasty in recent years. Still less than 10% of all surgeries are done computer-assisted in the US. We also conducted a population-based study that showed that in-hospital complications were much lower for computer-assisted cases compared to conventional cases. I was intrigued by the low adoption rate despite the better outcomes, and if that was driven by economic disincentives. We therefore conducted our analysis from a payer's perspective because we wanted to know if it made economic sense for payers to favor computer-assisted TKA over conventional TKA. We faced two main challenges when conducting the study. First, forecasting the long-term survivorship of computer-assisted knee arthroplasty was not readily available on US patients. We had to use data from the Australian National Joint Replacement Registry. Of course, Australian patients may have different survivorship rates than US patients. We also had to make different assumptions regarding the incentives of insurance companies for younger and older patients. Younger patients usually stay with commercial insurance companies between 3 and 10 years. Older patients are generally insured with payers like Medicare for life. Our simulation-based study showed that payers would save money with computer-assisted TKA. While we were expecting this result in older patients, we were surprised that even with younger patients and short-term coverage, computer-assisted was more cost-effective. Our study calls for two main action items. Not only do our effectiveness results indicate that computer-assisted has better outcomes for the patient, so surgeons should adopt computer-assisted knee arthroplasty for their patients. But our cost-effectiveness data show that payers should consider payment incentives to surgeons and hospitals to incentivize them to perform computer-assisted arthroplasty because it saves them money. Thank you.